Speak to the amendment, Mr. Speaker.
Gentleman has the floor.
Thank you, Mr. Speaker. Let's play a little game. Tell me who said this. I know you're excited. Tell me who said this. Who called the governor's access plan poorly designed, rushed, and incomplete? No, I'll give you more. These are real people. What happens when the program runs out of funding? Do we stop their doctor visits? Do we cut their medications in half? We are left holding the bag for this poorly designed program. That was the gentleman from Virginia Beach, Dr. Stolley. All right, you didn't get that one. There's one more. Who said this? The GAP plan was rushed and appeared to put politics ahead of good public policy. The gentleman from Suffolk, the chairman of the Appropriations Committee, said that this plan, that the governor's plan, is rushed. We saw this amendment here 2 weeks ago. The governor's plan has been working with medical providers, the healthcare industry, CMS, to put this together. And they called the governor's plan rushed. This plan that we just saw has been concocted 2 weeks ago. I call it the spaghetti plan. Let's throw something against the wall and see what sticks. Mr. Speaker, ladies and gentlemen of the House, there's some good things in here, but this budget doesn't go nearly far enough. We know that we're spending here with the community health centers and the free clinics, $5 million are going in there. A good thing, but could we be spending our money a little bit wiser? We're spending on the mental health portion of this. We're spending $15 million in the general fund for the first year and $98 million in the general fund the second year. But talk about a program that's rushed. This program is rushed. It's incomplete, Mr. Speaker. It's fiscally irresponsible. It's incomplete because we're talking about taking away entire health care plan from individuals and just giving them the mental health portion that they need. It's fiscally irresponsible because if we were to accept federal dollars, this population would be covered, would be 100% covered. So the $5 million I mentioned that are going to free clinics, that's good. They could use the resources. We've identified that we have an uninsured problem, but that money could be spent elsewhere. And I think a lot of people have some ideas on that. Mental health, $15 million the first year I mentioned, $98 million the second. Those dollars could be picked up exclusively by the feds. We'd be able to do some things with that I think is very helpful. So, Mr. Speaker, I think that this population could be served more comprehensively and at less cost to our taxpayer. So I don't think this budget nearly goes far enough in that regard. So I urge you to vote against this amendment. Thank you.